In my book, The Tech Solution, I really had to think about this. And I said, well, we all understand food. We all know that there's healthy food and there's junk food and there's toxic food. Well, we can understand the same way we consume technology. Neurologically, the brain doesn't finish its maturation till 25. And we know that the highest rate of mental health issue is 15 to 24.
Hey everyone, welcome to Darpan Chat Central. Mental health is a topic that's garnered attention in the recent times. With our reliance on technology, we're seeing mental health challenges come up in the classroom and at work, and most importantly, affecting children and youth. May 7th is Child and Youth Mental Health Day in British Columbia, and to talk more about it, I'm joined by psychiatrist with Future Ready Minds, as well as an award-winning author, Dr.Shimi Kang. Hi, Dr. Kang, how are you?
Thank you so much for that kind introduction. And thank you, Darpan, for highlighting youth mental health, child youth mental health, such an important topic.
Absolutely, there's no doubt about that. First off, tell me a little bit about the work that you've done in this field of mental health and what you've observed.
Right. So I've been a psychiatrist for about 28 years, and I started Canada's first program for mental health and addiction. And in that time, I would say the biggest change we've seen is the introduction of technology, our phones, iPads, screens, Netflix, and how that is impacting the human brain, our behaviors, and our physical and mental health. It's all interconnected.
Yeah, there's no doubt about that. Tell me a little bit about as to when we talk about children and youth, what have you seen with the reliance on technology? Because we can't just do away with it, but we do need that healthy connection. So tell me a little bit about that.
Absolutely. So right now we know technology is linked to anxiety, depression, eating disorders, body image conditions, addiction, video game addiction, and internet addiction disorder are diagnoses in Europe. They're coming here to Canada. We know that technology affects the blue light. The blue light affects our brain and dysregulates our melatonin and sleep cycles, even leading to things like diabetes and heart disease. We are seeing a decline in the most fundamental social skills because of technology, including empathy, rise in bullying. Cyberbullying is on the rise. Women and people of color are more likely to experience it. So it really is disrupting our society, misinformation and the polarization. We have a hard time talking about anything anymore, partly because of tech. So technology is impacting our physical health, mental health, societal health, especially for the young brain.
So how do we go about striking a healthy balance with it?
In my book, The Tech Solution, I really had to think about this. And I said, well, we all understand food. We all know that there's healthy food and there's junk food and there's toxic food. Well, we can understand the same way we consume technology. So just like the food we consume impacts our health and well-being, so too the technology we consume. So for parents and kids and teens, anyone listening, you want to consume healthy tech. Things like this chat, things like information, videos connecting with your community. You want to avoid the toxic tech like bullying and hate and the misinformation. And then there is the sugar. So the sugar is, we love sugar. Sugar is everywhere. Video gaming, scrolling social media, shopping. But that, like sugar, is highly addictive. And if we are exposed to it too soon, then we get to see problems. So that's why it's really important for parents to limit technology. And for the school system now, thankfully, here in BC, we're seeing limits on cell phones bell to bell here in this province.
All right. So what is the significance of a day that's marked Child and Youth Mental Health Day?
Yes. So let's talk a little bit about what mental health is. Mental health could be any brain-related condition, including anxiety, depression, autism, neurodiversity, even learning issues can fall under that. We are seeing a rise in all of those conditions, partly because of tech, partly because of the disconnection of our communities, partly because kids are too busy in activities and sleep deprived. So these conditions are on the rise. And in fact, mental health conditions have a greater impact on young people than all of the physical health conditions combined, if you can believe that.
That's insane. Well, thank you so much for taking the time, and thank you for coming down and sharing that information. We look forward to seeing more of you.
Thank you. And thank you, Darpan. And thank you to all the community members out there. I know so many people over the years have done amazing work for mental health in children. So thank you all.